Hello and welcome to Mixed Consistencies in Dysphagia Care using blended soups to meet IDDSI standards. I'm Jennifer McQuillan-Horner, Senior Nutrition Scientist at the Campbell's Company, and I will be your moderator today. Today's webinar has been made possible through the generous support of Campbell's Food Service. And as required by accrediting organizations, we will pause now for a few slides with our disclosures. Please join me in welcoming our speaker, Margaret Roche. Margaret is the founder of Roche Dietitians and the nationally recognized leader in nutrition consulting. Maggie's mission is to educate and empower those who nourish others. Most recently, Maggie has created IDDSI training programs that simplify IDDSI implementation, improve food quality, and promote safety. She has trained thousands on the IDDSI framework and testing methods. Maggie is a registered dietitian with a master's degree in clinical nutrition. She has advanced credentials as a board-certified specialist in gerontological nutrition and is distinguished as a fellow of the Academy of Nutrition and Dietetics. There will be 3 polls during the webinar. Each will give you an opportunity to reflect on how the topic applies to your practice. There will also be time for questions and answers at the end, so please submit the questions using the Q&A feature on your screen. Thanks for joining us, and now I'll hand things over to Maggie.
Thank you, Jennifer. It's great to be here, and welcome to all of you who are joining us. For the sake of the broadband, I am going to turn my camera off, but Jennifer and I both will, and then we will come back at the end during the Q&A. So you'll see me later. All right, there we go. Okay, so let's start with our learning objectives for today. And our learning objectives for today are that by the end of this webinar, you'll be able to recognize mixed consistency as a commonly overlooked risk in dysphagia diets, describe the key steps for preparing blended soups to achieve the intended IDDSI level, explain how the IDDSI flow test validates the IDDSI level of blended soups, and lastly, identify best practices and reliable resources for implementing IDDSI and managing mixed consistencies. A little bit of housekeeping. For those attending live, you will receive an email tomorrow afternoon with a link to your CEU certificate, and the certificate is for dietitians, dietetics, and dietary managers. If you don't see it, please check your junk or spam folder. The message will come from rd@rochedietitians.com. If you're watching the recorded version of this webinar, your CEU certificate will be available directly in the portal where you're viewing the session. And let's kick things off with our first poll. Now, please take a moment to participate in this poll. I'm going to bring it up now. Give me a second. Select the poll. It's a true or false. We haven't done those in a while. Here's a true or false. So please take a moment to participate in this polling question. Use this as an opportunity to evaluate your understanding of mixed consistency foods on dysphagia diet. If you're listening to this as the recorded version, go ahead and jot down your answer and then listen for how the live audience responds. So, true or false, if a soup has soft, tender pieces with particle sizes less than ½ inches for adults, it is appropriate for soft and bite size level 6. And we're getting a good mixture. I'm going to give it a few more seconds because it has to catch up. So many of you doing it at the same time. All right. This is very interesting. I'm going to go ahead and close it and share it with you. 58 say true, 42 say false, and in most cases, there's always exceptions, and we're going to talk about the exceptions. It is false. And that's what this entire webinar is about. So let's get to that. All right. Now, before we get into this whole concept of mixed consistency, which is the title of the webinar, let's take a quick moment to align on IDDSI. Some of you use it every day, others only occasionally or not at all. So as a review, IDDSI stands for the International Dysphagia Diet Standardization Initiative. It gives a shared, standardized way to describe food textures and drink thicknesses, along with practical, validated testing methods that anyone can use. It's for any age group across all settings. In short, IDDSI gives us a clear, standardized guidance for delivering safer, consistent dysphagia care. Now let's define dysphagia, because it's the why behind IDDSI. Dysphagia is a condition that makes it difficult or unsafe to swallow food or liquids due to problems in the mouth, throat, or esophagus. On this slide, you'll see a cross-section of the mouth, pharynx, and esophagus. By the way, the pharynx is located directly behind the mouth. This is the throat region that both food and air pass through. So swallowing and breathing share the same space in the pharynx. So the body has to coordinate those movements carefully. And when that coordination is reduced, food or liquid can move towards the airway instead of the esophagus. That's why dysphagia requires careful attention. Now let's look at how common dysphagia is in older adults. Depending on the screening tool used, 24 to 47% of older adults in the hospital have dysphagia. In long-term care, that number rises to 54 to 59%. And when we look at all adults over 60 across both community and institutional settings, a 2022 meta-analysis found a prevalence of 46%. In other words, dysphagia affects nearly half of adults age 60 and older. Building on that, let's talk about what dysphagia can lead to. You'll see the key consequences appear on the screen: malnutrition, dehydration, aspiration pneumonia, chronic lung disease, choking, and even death. And for older adults, these risks are significant. Dysphagia more than doubles the likelihood of a major health problem. People with swallowing difficulties are over twice as likely to develop pneumonia or become malnourished, and nearly 3 times more likely to die compared to those without dysphagia. Adults and children with dysphagia may also experience disinterest, reduced enjoyment, embarrassment, and/or isolation related to eating and drinking. These complications are why consistent standards and safe, reliable practices like IDDSI matter so much. So why does it matter? This slide breaks it into 3 key areas. First, standards. IDDSI gives us shared language, clear definitions, and simple testing methods. That consistency is what allows every team member, clinical and culinary and beyond, to prepare and serve foods and drinks the same way. Next, patient safety. When we use consistent standards, we reduce choking risk, support better nutrition, and help prevent avoidable hospitalizations. Safety is the foundation of everything we do in dysphagia care, and ultimately, this leads to quality, better nutrition, a more enjoyable dining experience, and better overall quality of life for people living with dysphagia. This is the heart of IDDSI, consistent standards that translate directly into safer care and better daily experiences for the people we serve. So just take a quick mental snapshot of this picture, because this is really the rationale that I use when people say to me, you know, why IDDSI? I can't talk anybody on my team into this. My administrators aren't interested. When you start talking about quality and patient safety in particular, you get people to listen. And there is a direct correlation between IDDSI and quality and patient safety. Now let's look at where you can access the tools behind these standards. IDDSI.org is the central authoritative source for everything related to IDDSI. Here's an overview of the online resources you can access. And many of you do this on a regular basis. The framework documents, which include the IDDSI standards and the testing methods, the audit tools, implementation guides, patient handouts, posters, product labeling information, publications, videos, and more. These tools are freely available to all of us and designed to support you at every stage of your IDDSI implementation journey. And even though IDDSI is international, there's strong support here in the US. The United States IDDSI Reference Group was created in 2020. I'm a member of that group. We're always looking for folks who want to participate in this group. So be sure to volunteer if you're interested, and you can have any level of IDDSI understanding to be involved. There you'll find practical tools, training videos, best practices and FAQs, advocacy resources, implementation ideas, research and regulatory support, all designed to help you put IDDSI into practice from a US healthcare perspective. Now that we've covered the foundation of dysphagia and the support available through IDDSI and the USIRG, let's take a closer look at one area that helps deepen your understanding of IDDSI: mixed consistencies. We'll start with what they are and then look at a few everyday examples. Mixed consistencies, or dual consistencies, are foods that contain both solids, and liquids within the same bite. This definition is an illustration of one of the many resources available on the USIRG page on IDDSI. That's where I got this from. So be sure to check all the resources that are available there on the US page of IDDSI.org. And here are two examples of the mixed consistencies that we just defined: solid chunks in broth, like chicken noodle soup, and cold cereal and milk. Both require managing a liquid and a solid in the same swallow. Some foods may look like single consistency on the plate, but quickly separate into two consistencies once they're in the mouth. A simple example is watermelon and other juicy fruit. It starts as a solid, but releases liquid immediately when chewed. This is why identifying mixed consistencies isn't always obvious by just looking at the plate. And why are mixed consistencies a problem for those with dysphagia? Mixed or dual consistency foods are more challenging because the person must control both the liquid and the solid components at the same time. This level of bolus control and timing requires more advanced swallowing coordination. That sets the stage for specific risks we see in dysphagia, which come from how the liquid and solid behave during the oral preparation phase of swallowing. During oral preparation of the bolus, or the amount of food in the mouth, the phase where the person chews the solids, manages the liquid, mixes everything with saliva, and maintains control of it in the mouth, the liquid and solid components of a mixed consistency behave very differently. First, the liquid components can separate early and spill into the pharynx before the swallow is triggered. For individuals who aspirate thin liquids, this early spillage creates a significant aspiration risk. Second, the liquid can wash solid particles into the pharynx before they are absolutely chewed. If those particles enter the airway, the person is at risk for aspiration of food particles, or if the piece is large enough, choking or airway obstruction. People who already aspirate thin liquids are at particularly high risk with mixed consistencies because they may aspirate the liquid that separates and spills while the solid is still being chewed. That same liquid can carry unchewed solids toward the airway too soon. In short, the liquid moves ahead of the solids, and that mismatch in timing is what makes mixed consistencies especially risky for individuals with dysphagia. Now that we've looked at why mixed consistencies pose a higher risk, let's connect back to how IDDSI classifies them within the framework. The only level, the IDDSI framework, that includes mixed consistencies is regular, level 7. Mixed consistencies may be included in easy to chew level 7 at the discretion of the clinician using a person-centered care approach. Mixed consistencies are not included in the following levels: pureed level 4, minced and moist level 5, and soft and bite-sized level 6. The best practice is that mixed consistencies are clinically evaluated before they're included in a person's diet. As the US IRG frequently asked question post on mixed consistencies states, clinical evaluation of a patient's ability to handle specific mixed or dual consistency items should be performed before recommending that these items be included on a diet. This means that a clinician should determine whether the individual can safely manage the liquid and solid component together based on their swallowing physiology and overall risk profile. So in general, just to review, we do not include mixed consistencies on anything other than regular 7, but some individuals may be able to tolerate them and do well with them, but it has to be after they have been assessed by a clinician that it's okay for them to have them. But then, how do we handle it on diet orders? And this is what we do. According to the USIRG FAQ, the IDDSI framework cannot change. In other words, we can't say, well, our version of minced and moist level 5 includes mixed consistency foods. But the diet order can be written on a case-by-case basis. This may include simple statements to describe the exceptions outside the IDDSI framework. So exact diet order wording is up to the specific facility. Clear diet orders are needed to avoid confusion when creating exceptions to the IDDSI diet orders. The diet order by the ordering healthcare professional may be following a clinician recommendation by either maybe an SLP or be based on decision-making by the person with dysphagia or perhaps their healthcare proxy. The medical team works in collaboration with the person's wishes, preferences, goals of care, and individual's ability to manage mixed consistencies and or to accept the risk. So obviously, communication and documentation are key to patient and resident care. So here's an example. You may have a diet order from minced and moist level 5, but after evaluating the individual getting this diet order, it's been determined that this person can indeed have mixed consistencies. So you may add to the diet order, may have mixed consistencies. Or maybe you prefer to use the term dual consistencies. Or, and this one's my favorite, keep it simple for the folks in the kitchen, this person may have regular level 7 soup. And then you'd figure out what to do about watermelon and super juicy fruit. You could include those on the list or just not include them if the resident or patient doesn't really care about those foods. All right. Now that we've covered what mixed consistencies are and why they carry added risk, we're going to narrow in on one of the most common examples, soup. Soup is a mixed consistency food. It contains both solids and liquids within the same bite. And because most healthcare food service organizations serve soup every day, we need a standardized approach for menu planning and a consistent method of preparation when serving soup to individuals on dysphagia diets. This ensures that soup is handled safely, predictably, and in alignment with IDDSI expectations. With that understanding of soup as a mixed consistency, the next question becomes, how do we modify it so it can be served more safely and within the IDDSI guidelines? Blending and thickening play a vital role in meeting IDDSI standards by helping ensure the soups are safer to eat for individuals with dysphagia. The right consistency can slow the flow and reduce the risk of aspiration and make eating a more comfortable, dignified experience. Routine soups for dysphagia diets should be modified until fully smooth and verified at the appropriate IDDSI level based on, of course, the clinician order of thickness. So how did we figure all of this out? Well, my team of dietitians, and then we also worked with chefs, we set out to create a reliable, repeatable method for soups that are appropriate for IDDSI. We had to take into consideration multiple variables. First of all, we knew there was more than one way to achieve this, but we focused on finding simple, easy to teach methods. And each method was refined through repeated testing and measurements. We had probably thousands of data points. Also, we learned quickly that in order to get a streamlined methodology, we would need different versions for different types of soups rather than trying to shoehorn everything into one method to fit many. You'll see what I mean as we go through the different methodologies. We used more than one type of thickener because we know everyone doesn't use the same thickener. We took into consideration the cost of the thickener and how much we would need to use. We wanted to make sure that the method of preparation was easy and as easy and streamlined as possible, but at the same time, we knew that the final product must meet the IDDSI standards. And here is a high-level view of the process we used to prepare the soups within the IDDSI standards. This is what I call our foundational methodology. So all of our methods really fall under this umbrella. We need to first prepare the soup to be fully smooth. If necessary, we blended it, and if there were small bits still present, we strained it. Then we heated it, thickened it, and validated the IDDSI level using the IDDSI flow test. This is the equipment we had on hand. We found our results varied depending on the equipment. For example, a high-speed commercial blender works so well, we didn't need to strain any of our soups. But when we used a food processor, we did need to strain some soups to get all the bits out. And this slide gives you a side-by-side look at the IDDSI drink levels 0 through 3. I'm including it here as a quick reminder of the drink levels before we move into the soup methods. Note that the last column lists the IDDSI flow test ranges, which is important because we use the flow test to validate the final thicknesses of our soup. Now, we developed 5 different methods of preparation, methods A through E, after experimenting with a wide variety of soups in our test kitchen. Different soup types behave differently, so multiple methods were needed. These methodologies are all a variation of that foundational methodology that I just showed you. Method A was a smooth soup. That's a soup without any pieces or bits. Method B is a broth-based soup with solids. Method C is a cream soup with solids. Method D and E are for single-serve soups, the little cans. Method D is the smooth soup. And method E is a soup with solids. All right, let's move on and take a look at these. Method A, smooth soup. This is the simplest methodology because it starts with a soup that's already smooth and contains no particles. So this kind of gives you a great overview of that basic foundational methodology. Step 1, and it's 4 easy steps. Step 1 is to reconstitute the soup according to the can instructions. And the strainer is only shown here to demonstrate that the soup had no bits or particles in it. You would not need to strain a soup like this unless whatever you serve happens to have some bits in it. And maybe the first time or second time first few times you do it, you might want to double check that there's no bits or particles in it. But this soup didn't have any, so in this methodology, there would be no straining. Step 2, simply heat the soup according to the can instructions, stir frequently to prevent scorching, and we heat to 185 degrees or greater. Now, this is one point in the process. where equipment made a difference for us. We found that using a heavy bottom pot helped prevent scorching, because if the soup scorches, you'll need to strain out those little scorched bits. So we wanted to make sure that we didn't have any, we had the right kind of pot, heated slowly, and stirred frequently, and that avoided the scorching. Step 3 is to whisk in the pre-measured thickener until it's fully incorporated and the mixture is uniform. After whisking, let the soup stand for 5 minutes to allow it to thicken, or follow the standing time recommended by the thickener manufacturer. Now, if needed, strain through a fine mesh strainer to remove any remaining particles, particularly if the thickener clumps up, and then you'd have a fully smooth final product. Now, we found we did not need to strain once we learned how to whisk well, and the chefs taught us that. So good whisking, getting that thickener in there, fully incorporated in there, and you end up with a beautiful, smooth product. Now, step 4 is to test the soup before serving. Use the IDDSI flow test, obviously, to validate that the final product falls within the correct range for the prescribed IDDSI drink level. And here are the results of the IDDSI flow test for this soup in 2 conditions. On the left, it's not thickened. The soup tests at thin level 0. And keep that in mind, because we're going to talk in an example of that. And on the right, it's thickened to, it's the same soup, but it's thickened to slightly thick level 1. And these 2 pictures show our test results when the soup was thickened to mildly thick, level 2, and moderately thick, level 3. And as a quick reminder, we now have a reliable way to measure how thick a liquid is. IDDSI provides an easy, accessible, objective test that anyone can do. It's the IDDSI flow test. It uses a 10 milliliter syringe and measures how much liquid remains after 10 seconds of flow. This gives us a quick and consistent way to classify drink thickness across settings and across different types of liquids. The IDDSI flow test helps us verify that we're serving the correct thickness, but it's new for many of us, and it takes a few tries to get comfortable with it. Here are a few best practice tips when testing drinks and other liquids. Use the correct syringe. The reference syringe must measure 61.5 millimeters from the 0 line to the 10 milliliter line. Syringes with different dimensions, including 12 milliliter syringes, won't give reliable IDDSI results. Check to see if you need to tap out air bubbles before starting the test. Some people use another syringe to fill the test syringe. I found these plastic pipettes. They're inexpensive, and I found it a good practice to use a pipette to fill syringes so you don't go through as many syringes. Temperature matters. Hot liquids are thinner and will run through the syringe faster. Cold liquids are thicker and will run more slowly, even when it's the same product. Always test at the intended serving temperature to get an accurate result. These small steps make the flow test more accurate and consistent across staff and settings. Of course, the main way to get consistency and results is with practice. And believe me, one does get better doing the test the more they practice. Now this slide walks through the steps of the IDDSI flow test. Here's how to perform it. First, remove the plunger from a 10 milliliter slip tip syringe. Then fill the syringe to the 10 milliliter mark, keeping the tip covered so nothing flows out. Start a 10-second timer and uncover the tip at the same time, and that lets the liquid flow. When the timer reaches 10 seconds, cover the tip again. Then simply check how many milliliters are left in the syringe. The remaining amount tells you the IDDSI level. This slide gives you a quick visual of a chef performing the IDDSI flow test. It shows the basic setup and hand positioning so you can see what the test looks like as it's being performed. And here are the results of the IDDSI flow test for thin level 0 through moderately thick level 3. The methodology is exactly the same for each test. The only difference is the amount of thickener used. Okay, ready for another poll? Please participate in the polling question. I'm going to pull it up. Let me get this going. Okay, and use this as an opportunity to evaluate your understanding of mixed consistency foods. Is it running? Poll is open. Okay. True or false? Blended soups need to be prepared for each IDDSI drink level that I serve. Now, if you're listening to this as a recording, please write down your results and then listen for the results of the live attendees. All right. And, oh, we got a good amount of people. And we've got, let me share this. 82% say true, 18% say false. Well, this is kind of a trick question. Technically, it's true, but I'm going to show you a little bit of a workaround on that as we go through the next few slides. So you're all right in a way. All right. So let's say your diet order is pureed level 4 thin. I'm sorry, pureed level 4 with thin level 0 drinks. Your diet order will determine which IDDSI level you thicken your soups to. So here's our example of the pureed level 4 with thin level 0 drinks. So would you serve that person a blended soup that's not thickened? But then what about all your other diet orders you have? Are you going to prepare every soup slightly thick level 1, mildly thick level 2, moderately thick level 4? That would mean 4 different soups per day. And for most healthcare food service operations, that is simply not realistic. So this might help. This graphic shows the IDDSI functional diet scale. The key idea is that the 2 levels specified in a diet texture prescription bracket a range of food and drink levels that are appropriate for that person with dysphagia. So in this example, the green check mark illustrates a diet order for minced and moist level 5 foods with mildly thick level 2 liquids. So if a clinician orders level 5 with level 2, it follows then that they are also comfortable with the patient or resident receiving level 5 foods, but also level 4 pureed foods and extremely thick liquids, level 3 liquidized foods, and moderately thick liquids. In other words, the diet order includes a range of levels that are appropriate for that individual, not just the 2 numbers written on the order. This is what makes soup production manageable, but because you don't necessarily have to prepare every soup at every IDDSI level every day. Let's look at this a little bit deeper. So most of us are serving food textures from easy to chew level 7 through pureed level 4, and drink levels from slightly thick level 1 through moderately thick level 3. So at first glance, it might seem reasonable to say, okay, we're just going to thicken all of our soups to moderately thick level 3, and that would cover everyone. And that was my initial thought when we began developing these methodologies. But here's the problem. Level 3 requires a lot of thickener, and that affects costs, and sometimes it impacts the flavor and the mouthfeel. It also may not reflect your actual diet order census. You may have very few orders for moderately thick level 3, and thickening the entire batch of every soup to level 3 means that many patients or residents would receive a soup that's thicker than necessary. For most operations, thickening the batch to mildly thick level 2 meets the needs of most, if not all, patients and residents. Then if you have a few orders for moderately thick level 3, you can prepare just those individual servings. So you can see it really depends on what your diet order census is. Only you can decide what levels you need to thicken to. Now, many SLPs point out that there is such a thing as too thick, because the thicker liquids can sometimes leave more residue in the pharynx. So whenever you can safely serve a less thick option, it's better for many people with dysphagia. And really the bottom line on this is it really depends on your patient or resident population, what your diet order census is, and what their individual needs are. And it really takes a team approach to figure out what your level is going to be. But once you've figured that out, then that can be part of your operations. All right, now we'll move on to our next methodology. This one is for a broth-based soup that contains solids. And this is really the typical soup that so many of us serve. And we're starting with a condensed soup. And because it's condensed, it's easier to strain the solids before reconstituting. So step 1 is to strain the solids from the condensed soup into a fine mesh strainer positioned over a stock pot. Reserve the condensed broth in the pot. Place the strained solids in a commercial high-speed blender. This prepares the soup components for the next steps, blending and thickening. Step 2 is to reconstitute the reserved condensed broth and add 1 can of water to the broth in the stock pot. Pour the water over the strainer so any small bits left in the can are captured before they reach the pot, because this is going to end up in the pot is what everything smooth goes into. Then whisk to combine. And then step 3 is to transfer 2 to 3 cups of the reconstituted broth into the blender with the strained solids. Blend for about 30 seconds or until the mixture is completely smooth with no bits remaining. If you still see particles, strain again as needed. Again, because we used a high-powered commercial blender, we did not need to strain after blending. And here's a few tricks for when using the blender. Start the blender slowly to help the mixture catch the blades and it doesn't then all stick to the side of the blender. Scrape downs regularly to ensure everything blends evenly. And step 4 is to add the blended soup mixture back into the reserved reconstituted broth in the stock pot. Once added, whisk to combine so the mixture is fully integrated and uniform. This completes the base before moving on to heating, thickening, and the IDDSI testing. So steps 5 to 7, we heat, thicken, and test. Step 5, heat the soup according to the can instructions. Stir frequently to prevent scorching and heat to 185 or higher. 6, whisk in the pre-measured thickener until it's fully incorporated. Let the soup stand to thicken according to the thickener manufacturer's instructions. Note, if needed, again, you're going to use the strainer if you need to. Generally, if you whisk well, you don't need to. And then 7, of course, IDDSI flow test to confirm your level before service. Now, there's some important notes about temperature, thickener, and testing. Temperature does matter. The thickener amounts in this methodology were validated at 165. Thickener amounts may vary. Thickener amounts may vary. Adjust as needed based on your IDDSI flow test results. We created a chart with the thickener amounts needed for each method to make blended soup at IDDSI levels slightly thick, level 1, through moderately thick, level 3, using both a starch-based thickener and a gum-based powdered thickener. These are general guidelines. Variability in thickener type, temperature, and time can all affect your final IDDSI level. Always test before serving. Use the standard IDDSI testing method to confirm the final level. And of course, as always, for full details, visit IDDSI.org. Now here's our third method, method C. This is the cream soup with solids. Now we needed a different method for cream soups with solids because the solids cannot be strained from the condensed creamed soup. It's too thick. So to strain the solids effectively, we must reconstitute the soup first, and that's what we're doing. In step 1, we added the whole can of water, but we reserved a cup of that water for blending. Then we whisked to combine. And you'll notice that we always try to work with the soup before it's heated. It's safer that way. Step 2, we strained the mushroom or what other solids were in that cream soup by pushing it through a fine mesh strainer over a stock pot using a rubber spatula. Then we placed those strained mushrooms into a commercial high-speed blender with that reserved cup of water. Then we blend for 30 seconds or until the mixture is completely smooth with no bits remaining. And then lastly, we added the blended solids back into the strained soup and whisk to combine. Now all we have to do is go back to our final steps of heating, whisking in the thickener, and testing. We've already talked a little bit about the factors that can affect the outcome of your final product. And here they are in one complete list. Variability in the IDDSI testing results may be due to the heating method and whether the soup scorched, equipment, with the power of the blender being the most important, measurement tools, how accurate are your water and thickener measurements depends on how good your tools are, thickener brands and types. We used 2 different types of thickener and 2 different brands and thus needed different amounts of thickener for each. Soup formulation. We worked with condensed soups. With ready to serve, you would not need to reconstitute and would adjust your methodology accordingly. Time. Thickeners may change over time, and it's the same with temperature. And lastly, the individual preparing the soup and performing the test. But we all get better with the more we do, and that's why training and practice is so important. Here's a quick overview of the thickeners used in our testing. There are several types of thickeners, and each has its own characteristics. For our soup methodologies, we used both a starch-based thickener and a powdered gum-based thickener, and we were able to get good results from both. And this chart shows the thickener amounts needed when using a starch-based thickener for our soup methodologies. It lists the amount of starch-based thickener in grams and tablespoons required to reach the IDDSI levels slightly thick level 1 through moderately thick level 3. The amounts are specific to the methods we just described. All amounts were validated at 165 degrees, so temperature again is an important part of these results. The chart would be used as a starting point. The final IDDSI level must always be confirmed with the standard IDDSI testing method, the flow test, before serving. And now for our last 2 methods, we will switch to the single serve cans. These methodologies are very easy and depend on whether the soup is already smooth or contains solids. Method D, I do not have that pictured here, but it is the smooth single serve can. It's so simple, I didn't include the pictures. But basically what we do is we empty the can into a microwave safe bowl or small saucepan. We whisk in the pre-measured thickener until completely incorporated. We let the soup stand to thicken per the thickener instructions. Then we heat. We heat the soup for best results in a microwave and microwaving it to 185 degrees or higher. And then of course, our last test is to test it before serving. Now here you'll also see this method E, and that's what's pictured. And that's if the single serve can has solids. This is super easy. We simply empty the can into a commercial high-speed blender and we blend for 30 seconds, gradually increasing the speed to high until completely smooth and there are no bits. The chefs taught us this. With small amounts in these big commercial blenders, it's best to use a low speed to get everything to break up and get those pieces small instead of getting them to scatter all over the inside of the blender vessel. So small increments and increase in the speed of the blender really helps, but you need the power of the blender to really get it to be completely smooth. So once we have that part down, it's easy because you can add the thickener right to the blender and blend it on a low speed for 5 seconds. And if needed, strain. But again, we didn't need to strain ours because the blender did such a great job. And then you heat it in the microwave for and get it to 185 degrees or higher. And then, of course, test it. All right. Now let's look at our final polling question. All righty, hold on a second. Let me get that up and ready. It's time for our last polling question. Our goal has been to give you the opportunity to reflect on what you've learned and to identify some best practices to take with you. Is there anything that you'll be trying? You may use the chat function to type in other best practices that may not be listed here. If you are listening to this as a recording, please write down your responses and listen for the results of the live attendees. Here are the questions. What are the 2 best practices that you are most likely to incorporate into your practice after attending this webinar? And I'm going to launch it. It's going to take a few seconds for you to be able to see it. And you can try to pick 2, please. Will you evaluate how mixed consistencies are served at your organization? Incorporate methodology for blending soups? Use the IDDSI flow test for validating IDDSI soups? Consider the menu, diet manual, and/or policies related to mixed consistencies, or other? I'll give you a few more seconds. All right, I'm going to close the poll. I think we got most of you, and share. Okay, the most common response at 68% was evaluate how mixed consistencies are served in my organization. I think that's a biggie. Didn't we all learn something today? You know, this is kind of a deeper dive into IDDSI, so this is new. Incorporate the methodologies, that's nice. That's our second highest one. 33% will use the IDDSI flow test, and 53% will consider the menu, diet manual, and/or policies. We could have had a whole hour just on that, right? And then a few folks used the chat. I don't see anything popped up there yet. All right, but now we've got time to talk. I try to keep my comments to 50 minutes because I know sometimes we run to the top of the hour, and I know this is a new concept for many folks. So we are going to move on to the Q&A portion. I will put my camera back on. I'm going to invite Jennifer to come back. We are also going to hear from Sabrina, who will introduce some of the questions. And while we're waiting for everybody to get organized on that, I did get an email question today, and it was about ice cubes. You know, we could consider ice cubes a mixed consistency when you think about it. I've talked with several SLPs about this, and I would say the answer to it is really work with your SLPs and your organization. Some feel it's really important to let people with dysphagia have ice, especially if it's in a covered cup. It's not going to get into their mouth. Others have said to me, it melts so fast, it's really not a problem. It's hard to choke on ice. I didn't know that. The other thing to consider is thickening your ice cubes so that when they do melt, they remain at the thickness that your level, your prescribed thickness level. So those are some of the considerations for ice cubes. Okay, Sabrina, any other questions that we have up?
Yeah, can you hear me okay?
I can, thanks.
Sure. Okay, it looks like our first question, have mixed consistencies always been allowed only on level 7, or is that something that has changed since its initial implementation?
No, it's always been that way from the beginning of the framework.
Okay, then where do you order the syringes from?
Oh, the syringes or the pipettes? The syringes. I find them on Amazon. If you go to IDDSI.org, they give you a few brand, at least one brand, that BD brand, and they'll tell you what the syringe number is. I have a hard time getting those. I think maybe those of you who work like in hospitals and those types of institutions where you've access to medical supplies, you'll probably have better luck. I don't have access to that, so I had to go through Amazon. But I found them. But if you measure them, then you know you're right. There's also the IDDSI funnel, which is a little bit bigger, and it just has the IDDSI levels on it, and you can order those from IDDSI.org as well. I should have showed you that.
Okay, and then the next question I have, this is for a facility that has not transitioned into IDDSI terms. What would honey thick liquids be considered?
Honey thick is moderately thick. And the way you can remember that is moderately thick also happens to be that bright yellow color, kind of think yellow honey, but it's very similar.
Okay, next question. Oh, did I interrupt someone?
No, go on.
The next question, are you flow testing at 185 degrees?
we were, believe it or not, and you have to kind of be a little careful. But with such a small amount, it's not as hard. But you can see that's why with all of this methodology, we were like, the last thing we're doing is heating the soup, because even all those steps we were taking, we didn't want to do it with hot soup. But that's a good question, and it wasn't as bad as it sounds. I know the dietitian who helped me with this, Miriam, she's listening in, so I wish she could answer as well, because she's the one who did the most of the testing, and I don't recall her burning herself. So, and she did literally thousands of them.
Mm-hmm.
So yes, the answer is yes, we do test it hot.
And any tips for that process if you are testing hot soup?
Well, again, it's such a small amount. It's literally 10 milliliters in the syringe. You got to work fast because you don't want it to cool off, and you're touching the edge of the syringe with your fingers. I don't know if you can see me, but you're touching the top of the syringe with your fingers. So it's just that little part where your pinky is, that's the problem. And we use those pipettes, so we weren't touching the soup. So it was not really a problem for us.
Okay.
Maggie, we still see the poll up.
Oh, I'm sorry. Thank you for telling me that. Let me see.
Sorry,
if I can
Sabrina.
No worries.
hide. There we go. Now, can you see me?
Yes.
All right, good. Thank you.
The next question is on the diet order ranges slide. For level 7 and 6 foods, it states no food allowed above level 5. Should that state no food allowed below level 5? Is there a typo on that slide?
No. Think about level 6. They can have 6, 5, and 4. So for example, think about your level 6 person. They can have pudding, which could technically be considered pureed level 4. But you wouldn't give someone on pureed level 4 a minced and moist level 6 piece of meat. They can't go up higher, but everyone can go lower with their numbers. If that was the question.
Yes, I believe that's how I interpreted the question. The next item we have here, if it takes the patient a while to consume their thickened soup, does the thickness level change?
Oh, I wish Miriam was here because she knows all this off the top of her head. We tested it at, yes, it does. But remember, we have that range on the syringe, and we tried to make sure that the amount of thickener used got us to the point in the syringe that as it cooled off, we still stayed within range. And you can go as low as, and again, I'm just using this as an example, it may not be the exact number, but it's somewhere around, let's say, 150 or 160 degrees, it'll still stay within range. Once you get into the 140s, and we stopped testing at 140 because we were like, it's not soup anymore. It's not even hot. But once you get into the 140s, you might have some trouble of being out of range. But that's a good question, because you're going to test it at 185, but by the time it gets to the person, by the time they eat it, especially the slow eaters, it will thicken up. Try to stay within that range, within your, because again, your IDDSI level is not one number. You're between 1 and 4, or 4 and 8, or 8 and 10, depending on what the level is. So that's a good question, but we got you on that with the levels.
Okay, next question here. Does the Joint Commission require that a facility have IDDSI standards?
Ask the question again, please.
Does the Joint Commission require that a facility have IDDSI standards?
Joint Commission does not have specific standards or guidance about IDDSI. Neither does CMS. However, all of these accrediting organizations or licensing organizations require that we follow professional standards of practice. And IDDSI is the only textured modified diet recognized in our the Academy of Nutrition and Dietetics diet manual, or nutrition care manual. The Academy also endorses IDDSI. And the ASHA, the Speech Language Hearing Association, they also endorse IDDSI as well. So it's part of our professional standards of practice, and to provide quality of care, you have to follow your professional standards of practice or have a really good reason you're not, and being able to validate that and support that.
Okay, next question here. Where will the recording be hosted?
Okay, so it'll take us a while to get it posted, but Roche Dietitians hosts the webinar, but we will link it to the Campbell's food service page, and we will send you out an email in the next week or so when that's up. And if you know someone who hasn't gotten continuing education on this, dietitians, dietary managers, and dietetics will also be able to get continuing education on the recorded session.
Okay, I'm gonna skip down to a cereal question. How do you handle cold cereals? Are they soaked and then the milk poured off, or is that also blended?
It depends. It depends on what you want to do and what the patient or resident wants. Technically, you can do either. And especially if you were going to blend it, then you'd have to thicken it to the appropriate consistency for that person's drink level. But what I personally do on my menus is I don't serve it. I just give them hot cereal because I think it's kind of gross. But some people really enjoy that flavor and a nice cold cereal, particularly in the hotter climates. So what works for your patient or resident population, what works for your kitchen operations is what you can do. But either of those methods, as long as it's smooth and it meets their diet level, if it's pureed, that's different than if it's soft and bite-sized in terms of soaking that cereal, making it soft, getting it to the right consistency for the diet order, or blending it and making it appropriate for the drink level.
Okay, and one more question here. Can you please repeat the stats at the beginning of the presentation about the increased health outcomes associated with dysphagia?
I don't have them off the top of my head, but I'm going to try my best to get over there for you. Hold on a second. And this will be in the recorded session, so see how the chef's doing it. By the way, there's that hot soup, but chefs, they don't feel anything in their fingers. But I'm telling you, we did it and it wasn't bad. Okay, you're getting, I got a few more. Hold on, stay with me here. We're getting there. This is like a flashback of your life flashing before your life. Before your eyes. Okay, here you wanted the stats on this, on how common it is. Sabrina, what was the question again?
Increased health outcome.
Okay, here we go. Now you know I didn't have the. You know that's a good thing. I'm gonna take that as a suggestion. Next time I talk about these, I'll make sure that the numbers are on this slide. Here you go. For older adults, these risks are significant. Dysphagia more than doubles the likelihood of major health problems. People with swallowing difficulties are over twice as likely to develop pneumonia or become malnourished, and nearly 3 times more likely to die compared to those without dysphagia. And then adults and children with dysphagia may also experience disinterest, reduced enjoyment, embarrassment, and or isolation related to eating or drinking. That's a good suggestion, though. I'll get those numbers on the slide next time I talk about this. All right, how are we doing? I think it's time, isn't it? Sabrina, are we okay to finish up?
Yes, all good on my end.
Okay, then I welcome back Jennifer to say our goodbyes.
Thank you, Maggie. Thank you for all of that valuable information and the valuable IDDSI resources for everybody. Please make sure that you utilize them. Thank you for joining today's webinar. We appreciate your time, engagement, and commitment to safe, consistent nutrition care. Today's webinar was sponsored by Campbell's Food Service. Thanks and have a great rest of your day.
Thank you. Bye, everybody.